Well, since the health of the people of the Niger Delta region is very important, it is really pertinent that we talk about this aspect. Another main conversation is on health insurance, and it isn't just about policy, it's about protection, ensuring that a family crisis doesn't become a financial catastrophe in the Niger Delta, where environmental hazards, economic inequalities, and access gaps already challenge public health. The stakes are even higher. Today we're asking what's working, what's failing, and what's the realistic path toward health security that serves everyone. We have joining us live on the program, Board Chairman of Akwa State Health Insurance Agency and SSA Health Insurance, Dr. Edikan Ekwere. You're welcome on the program. Thank you for joining us.
Thank you for joining us, Doctor.
Thank you. Thank you very much. It's a pleasure to be here.
Good to have you. Well, in 2023, the National Health Insurance Authority reported that less than 10% of Nigerians were enrolled in any form of health insurance. But then when we look at the Niger Delta region, we want to know if that statistic still hold water. Start from Akwa Ibom, where you represent and have your foot on the ground. What has health insurance really been like? Because, I mean, it's as if we seem to have only people in the government circle, for instance, civil servants being enrolled. You look at this health insurance scheme in the state and broadly in the Niger Delta region, what would you say it is like currently?
Okay. I want to say categorically that that statistics as at 2023 does not really hold again today. Because as of 2023, the Akwa Ibom State Health Insurance Agency wasn't launched. And between September 20th, with the Executive Governor of Akwa Ibom State, His Excellency Pastor Umo Obaseno, launched the Arise K, that's the Akwa Ibom State Health Insurance Scheme. We have enrolled over 130,000 beneficiaries. We have enrolled over 130,000 people in Akwa Ibom State. So if you add that to the already to the statistics in 2023, that would have changed. And we are registering more every day. So since we came on board on the 2nd of July and the scheme was launched on the 20th of September last year, we have gone on massive enrollments. And this month, we are going to start onboarding the civil servants, the formal sector. So the Commissioner for Digital Economy just called me before I came here and asked that and informed that he had gotten our letter to start deductions from the end of this month. So with that, if you consider that Akwa Ibom State has about 52,000 civil servants and our scheme covers for the principal, the spouse, and then 4 children under the age of 21 years. If you add that together, the formal sector alone will be having about 200,000. That's adding to the pool of the already enrolled people in Akwa Ibom State. So far, over 100,000 people are benefiting from the health insurance scheme of Pastor Umo Obaseno. And that is tremendous. It has really quashed the out-of-pocket expenditure as it has to do with health. So that's the statistics that you mentioned has changed tremendously, because I also know that the other states in the Niger Delta region are also doing very enormous work. They're enrolling, and not just about the enrollments. People are obtaining standard, effective care courtesy of these social health services that we are rendering.
Doctor, with what you've said so far and what the state government, including the other states, have done so far, would you say that we are close to achieving universal health coverage?
We are on the way to achieve that. We are a step closer than what we were in 2023, but it's still a long way to go because the budgetary allocation, many things are there. Hospital and getting to access care and all that. So, I mean, we are moving closer and closer, but then the journey is still far ahead.
Well, Doctor, when we talk about state-level health insurance schemes now operational in different states of the Niger Delta region, Another conversation that comes up is the issue of awareness. How well informed are the people of the Niger Delta states when we talk about health insurance? Do they take it seriously, or it is just another stroll in the park, a conversation that they hear and they be like, okay, this initiative, and they are not really well informed? How informed are the people?
I can speak for Akwa Ibom State categorically because I have been here for the past 1 year, and I have seen the work that it has we have done in the health insurance scheme. So the issue of awareness is key. We are partnering with the Christian Association of Nigeria. We are partnering with the Ministry of Local Government and Chieftaincy Affairs. We are partnering with the Ministry of Humanitarian Affairs to drive awareness and publicity. But I want to say that so far, many people, more than about 2%, more than 2% of Akwa Ibomites are away. I'm speaking for Akwa Ibom now, are away because if we have enrolled over 130,000, that means that these people have been aware of the scheme before they got to enroll. And many other people are enrolling. So these people have relatives, they have dependents and associates. So they go, they spread this word, and we are embarking on a massive radio and TV awareness, just like what we are doing here. So we are going to the trenches also. We are involving the churches and all that to disseminate this information to the people. And I'm sure in the nearest future, the awareness would have percolated into all the nooks and crannies of the Niger Delta region.
All right, Doctor, how accessible and affordable is this Akwa health insurance scheme?
Yes, it's one of the most affordable schemes in the country. Let me just mention that in April, the Akwa State Health Insurance Agency was awarded as the fastest growing state health insurance agency in Nigeria. And we have done many other things, enrolling people and making sure that these people actually get the help that they want. So affordability for a single person, if someone comes to register with us singly, we charge just a token of 18,000. That is for the whole year. 18,000 to get antihypertensives, to get anti-diabetics, to get laboratory tests, to get scans, to even get CAs, that's cesarean section, and other surgeries for 18,000. Now, if you split that up, that will come to about 1,500 naira only per month. But if people come in groups, like associations, churches, and all that, we come down by 1,000 and then charge 17,000 naira per head. But we are encouraging families to enroll. So for families that are not in the civil service, we just get 16,000 naira, a further discount of 1,000 naira to encourage families to enroll. This 16,000 naira is for the father, the mother, and then 4 children, so about 96,000 naira. But if you divide that by 6, it is 16,000 naira. So 16,000 naira for 1 year is affordable.
What about the accessibility? How can they access maybe facilities that are actually giving out the services?
Yeah, so when we set out, we wanted to decongest the University of Your Teaching Hospital, which is the only tertiary facility in the state currently. So we decided that, okay, we should drive we should take from bottom to top. So people would have to be enrolled at the primary healthcare level. So for now, we have over 89 primary healthcare centers in Akwa Ibom State that are offering this case. So that's, if you do the math, that will be at least 2 primary healthcare centers in each of the local governments. Specifically, all the primary healthcare operational bases, which is almost always at the local government headquarters, they provide this care. And if the particular care is not at the primary health center level, or the expertise is not there, these patients are being referred upwards to secondary health facilities like the Emmanuel General Hospital, in a case like the General Hospital in Ekwere or Equitarium. So they go there and obtain care. But if they go there and they don't still have that expertise there, they further refer them to the tertiary level, which is the teaching hospital. So they go there and still obtain care free of charge, fully paid for by the Akwa State Health Insurance.
All right, Dr. Ekwere. Well, another very key area that usually comes up is the issue of sustainability. And oftentimes you'd see administrations come in with very lofty ideas like the health insurance that we're speaking of right now. But then right after that particular administration serves its course and another one comes in, you see dwindling fortunes. It is not really working anymore. You begin to wonder what happened and why couldn't we continue effectively into the new administration? Do you think that this health insurance provision has come to stay, or we're going to be running into another bottleneck, let's say maybe after this administration serves its course?
No. I don't think it's going to dwindle. Sustainability is key. The law that is establishing the Akwa Ibom State Health Insurance Scheme makes it mandatory. By making it mandatory, it means that it's for all the citizens and residents of the states. As for sustainability, we have very good commitments from the state governor. The political will is there, and this made him to launch this scheme and put in place the board, which by the grace of God I chair, and we are making policies that will outlive this administration. So we are currently, a memo is on the table of His Excellency the Governor of Akwa Ibom State to give us what we call equity fund. That is about 1% of the consolidated revenue of the state. It is enshrined in the law of the states, or 5% of the basic revenue, internally generated revenue of the state should be given. So once that is signed into law, once that is approved, that will be coming in yearly. So as they are passing the budget, as they are starting to implement the budget, they are now remitting that percentage to health insurance. That will not just be for the Pastor Moino's late administration. It will outlive this administration, and so sustainability won't be a problem.
All right, Doctor, you agree with me that this is a huge responsibility. Is the state government, aside from the equity funds, actually partnering with donor agencies to ensure that maybe more funds can come into the scheme?
Yes. Also, in that same law that's establishing the Akwa Ibom State Health Insurance Scheme, it states that for companies that are for all the contracts that the state government awards, that 1% of that contract, provided that contract is above 50 million, should be remitted to the health insurance scheme. Apart from that, there's also provision for partnerships with donor agencies, international bodies, NGOs to help. Currently, ACUS is helping. The MD and CEO of ACUS, Dr. Andieyo, has paid for all the workers, over 1,500 of them, to be enrolled in the scheme. And we are also trying to get support from Bill and Melinda Gates, and then from other big-time partners and NGOs overseas and around the country.
Well, I know that these collaborations also factor in the fact that they are citizens who would not even be able to afford even the 16,000 naira that you spoke of, which is, of course, subsidized heavily. Are there provisions for citizens who are in that cadre who can't simply afford any of these?
Yes, very well. We have different packages. There is the packages for the vulnerable people. There's a package for the formal sector, and there is a package for the informal sector. For the vulnerable package, that is the one you're talking about now, we make use of the National Social Register. Yes, there are some issues with that, but also other people that are in the vulnerable group include pregnant women. All pregnant women in these states are entitled to free health insurance service. All children that are born today from 0 to 5 years old are free
Okay.
Health insurance is free for them. Disabled people, as people living with disability, it's free for them. Internally displaced people, the health insurance scheme in Akwa Ibom is free for them. Prisoners, let me just mention that we have enrolled all the prisoners in this state into the scheme. So they just go there. If they are ill, they take them to these facilities and they get care. Again, we have enrolled over 50% of all the motherless babies in Akwa Ibom State.
All right, Doctor, let me take you back a bit to the donor issue. President Trump recently canceled 83% of the donors program. How is it affecting national coverage as a whole? And is there any strategy put in place to ensure that the void is being filled?
Yes, we are not wholly dependent on the donor agencies. That is why we have put in place structures to really help sustain the scheme nationally and in the states. So even though he has cancelled most of those aids, but we are exploring other options apart from USAID and the ones that President Trump controls. We are also doing other things to help.
Board Chairman of Akwa Ibom State Health Insurance Agency and SSA Health Insurance, Dr. Edikan Ekwere. We must thank you especially for speaking with us on Niger Delta today. We appreciate your views and ideas on the program.
Thank you. Thank you very
around.
much. My pleasure.
All right, so that's the size of Niger Delta today. Thank you very much for staying with us. We'll catch you again next week for another fresh edition of the program. My name is Xavier Robert, wishing you a terrific weekend.
And I am Siphon Ode. Good afternoon.